Fortunately, over the last couple of years, there have been prospective investigations into IO-TKI combinations that we're familiar with from the clear cell setting, now investigating them in the non-clear cell population. The largest of these studies was the phase 2 Keynote B61 trial that looked at lenvatinib and pembrolizumab, a regimen that we're comfortable with from the clear cell setting, and looked at it in really all comers in the non-clear cell space. So the study included papillary, chromophobe, unclassified, translocation. This was a large international study, included 158 patients at the standard dosing of lenvatinib and pembrolizumab, and really showed remarkable responses of response rates approximately 50% across the board. The chromophobe subpopulation had a lower response rate of closer to 35%. But really across the board, easy number to keep in mind for the lenvatinib and pembrolizumab was basically a response rate of approximately 50%. Perhaps even more impressive than that is looking at sort of the median progression-free survival numbers. We're used in this setting to maybe 10 months, 11 months. And with lenvatinib and pembrolizumab, we saw a median PFS of almost 18 months, so approximately a year and a half for a median PFS, and an overall survival that had not yet been reached. So I think this is a wonderful choice for patients with non-clear cell, really regardless of whether it's papillary, chromophobe, translocation, et cetera. And those are kind of the highlights from the B61 study, which is ultimately what led to its inclusion as a preferred regimen in the NCCN guidelines. Cabozantinib and nivolumab is also included in the NCCN guidelines as a preferred regimen for non-clear cell RCC, and that's also based on a single-arm phase 2 study looking at cabozantinib and nivolumab in non-clear cell patients. I want to highlight a couple of differences between the cabo-nivo study and the lenvatinib pembrolizumab study. This was a smaller trial. There was a chromophobe cohort that was closed early, so we don't really have deep analyses in the chromophobe patients. So this study essentially had 40 patients, which again is much smaller than the Len-Pem study, looking at papillary, unclassified, and translocation RCC. Again, cabo-nivo at the standard dosing that we're used to from the clear cell setting. And here too, I would say, the easiest number to keep in mind is kind of that 50% number. For patients who received cabo-nivo and non-clear cell in the first line, response rate's a little over 50%. When you narrow it down just to the papillary cohort, because that's the most common of the non-clear cell patients, that was 32 of the 40 patients in the study. The response rate was 47%. And again, when you're looking at median PFS, the median PFS for the cohort at large was 13 months, and the median overall survival at 28 months. So another terrific option, kudos to the companies for putting money and time and effort into non-clear cell RCC in a prospective manner. As I summarize these two data sets, I think they're really both good options for patients. The Len-Pem study is a larger study, international. The cabo-nivo is slightly smaller. The Len-Pem study had chromophobe included. The cabo-nivo, we don't have that. The response rates are fairly similar at around 50% in both of the studies. And we're waiting for the median OS in Len-Pem, but that number looks to be about 28 months for cabo-nivo. So really wonderful that we do have options for patients. For me, I do think an IO-TKI combination is a standard of care in this setting. And the choice of treatment comes down to personal preference, personal interpretation of the data. But I'm glad to see these options available for patients and included in the NCCN guidelines, which makes it more accessible to patients.